Welcome back, Smile Jammers. The COVID-19 pandemic presents unique challenges for people with substance use disorders and with their recovery. Joining us this morning from the National Council of Drug Abuse, the NCDA, is Executive Director Michael Tucker and Research Analyst UK Atkinson. Good morning, guys.
Good morning.
Hi, morning.
Welcome to Smile Jamaica. It's
Thank
morning
you.
time. I will admit that when we started the conversation about COVID-19, substance abusers were the last thing that came to my mind. You know, so Michael, I'm going to start with you. What are some of the unique challenges that COVID would present for people in this group?
Okay, it negatively affects your immune system. Now, your immune system really helps the body to fight diseases, your pathogens, etc. So, if there is a virus that is introduced that is an aggressive virus, a substance abuser is more likely to succumb to any diseases that virus presents because of a compromised immune system. So immune system generally fights diseases either by destroying any strange viruses that come in. It can also isolate that virus and prevent it from reproducing, or even cases where you have cells that become abnormal and start to multiply, then the immune system also will try to remedy that situation.
I want to jump in before Simone, because maybe not here, well, I don't know of it here, but I know there was conversation globally about vaping and other forms of smoking, and that was significantly compromising respiratory systems, but in young people.
We actually spoke with UK about that last time you were here.
So internationally, you're correct.
Right.
What the data is showing, of course, there are countries that are further ahead than we are in terms of the disease process. So countries like China, Germany, Italy, Iran, we're getting data from them, which is disaggregated by sex, etc. And what we're seeing is that lifestyle factors such as smoking, vaping, and alcohol consumption are significantly related to mortality, not just getting the disease, but the complications that are associated with COVID-19. And so, and also men are disproportionately more affected. In other words, more men are dying from all age groups.
Why is that?
Because men are more likely to be engaging in those practices all around the world. There are significantly higher prevalence. There's a significantly higher prevalence of smoking, of alcohol consumption, those kind of lifestyle-related factors that predispose you to conditions like COPD, that's chronic obstructive pulmonary disease and so on. So yes, there is a unique risk for people who have substance use disorders.
Does it matter which substance you're using? Does it make you more susceptible? Right. So is it nicotine? Is it cocaine? Is it vaping? Is there one that will have a more chronic or lethal?
So first of all, we need to say that it's very early in the game. And we don't have enough evidence to say that this causes that or so. We're looking at the associations based on the data that is coming out thus far. But certainly cigarette use, vaping, ganja use, anything that causes, the lungs are not designed for smoking, right? And alcohol. Now, we've seen memes going around where people are saying, I just need to smoke a little spliff and drink some white rum and I'm good. That's actually the exact opposite of what it will do for you. It's not going to protect you against a disease. It's actually shown to make you more susceptible to the complications. So not everybody will get terribly sick and need to go into ICU, but those who are engaging in chronic substance use are more likely to end up with complications and death.
For the people who think I don't smoke, I don't touch weed, I don't touch nicotine, but I have a drink, I have a lot of drinks, you are also at risk.
Yeah, you are.
Absolutely.
Yeah.
So alcohol consumption, and we have when we look at our data from our national surveys, it shows that alcohol consumption is highest in terms of the types of drugs that are used most regularly by our Jamaican population. And early use is also something of concern. So young people might feel like, oh, this is an old people disease.
Yes,
This is a disease for just the people who have, you know,
I'm young,
Underlying
attention is for me
conditions.
because my body can bounce back
Yeah.
quickly.
Yeah.
No.
Yeah.
What we want to do now is ensure that our bodies are as healthy as possible. So
Immune
lay off of
system
the
boosted.
alcohol. Yes.
But you know, the irony of this, as we talk about this, is that this is the kind of situation that will drive the drinker to drink more, that will
definitely.
make the person go to find some kind of comfort in
Yes.
whatever drug it is that is theirs of choice.
Stress-related problems. I mean, in an environment like this, with all the fear factors,
Yeah.
people are very stressed.
Anxiety.
People, so they're anxious, they're bored, their normal way
Routine.
of operating has been disrupted, and then you have often staying home, kids present, a number of other things, and trying to reorganize your life around that. And also, drinking at home, as opposed to social drinking where you may be out with friends and just having a drink, it's totally different. You tend to consume more. You may get depressed, and then too, there's a link between mental health too,
Yeah.
and your immune system
Yeah.
and its ability to fight diseases. So if you're depressed, if you have other mental issues, that also compromises the immune system. And two, we know that alcohol does lead to if excessive alcohol use does depress a lot of people.
I'm going to throw something into the works. Now when we hear COVID, people are self-medicating. And we know what opioid addiction is doing around the world. Are we fearful that people are now going to just run out and start? Because when you call pharmacists are saying something's done. And people are going to run out and start buying tablets and taking them and no, we're not fearful
But
of
they
that.
shouldn't be able
No.
to get. They shouldn't be able to get certain
Well,
things over the counter.
Right.
Opioid.
So we can only speak based on evidence.
You're right.
And our successive studies have shown that we do not have opioid problems. I mean, certainly not comparable to countries like the US and Europe.
Thankfully.
Last week we were on an international webinar put on by the International Society of Addiction Medicine. And countries like Iran and Norway and Germany and so on were presenting. And their crisis is dealing with opioid substitution therapy within this whole COVID environment. Thankfully for us, our crisis is to support those people who we know are struggling now because of the additional stress that COVID has brought. I mean, we have gotten calls from clients to say, look here, I don't know, the hopelessness, I feel like I'm going to relapse. Because as we know, substance use disorder is a highly relapsable type of condition, you know, so in times of stress. So what we really want to tell the general public is to look out for those family members and friends
Who you know have-
know are more likely to, you know, go back into their
And
own
what do you do
lifestyle.
with? You say look out, but what do you do with? What do you do for them?
Okay, so for us, we have had to change the way we operate. Certainly, we're not doing the way that you deal with substance use disorders is, you know, individual counseling, group counseling, and so on. That is being discouraged now, right? We're not, face-to-face contact is not in. So we have had to take our services to telecounseling, right? Our number, and I need to put it out here. Our number is 876-564-HELP, which is 564-4357. And what we're doing is we've had to, you know, identify the clients who are at greatest need at this point. Who are the people who are likely to relapse? Who are the people who are reaching out and saying that, you know, they're totally stressed out? Children are home. We understand the Ministry of Education's reason for closing schools, but it's also creating a whole lot of additional stress. So there are tips for parents in the homes who are having to deal with, you know, having the children around, you know.
Do you have the resources to handle it? Do you guys work closely with organizations like RISE or?
We have a network that we work with closely. The fact is that there are more resources that are required to deal with the substance use problem generally. A lot more people that need treatment, rehabilitation, a lot of work that needs to be done in the area of prevention and education and impacting young people. Because there are a lot of misinformation out there, a lot of influencers that will lead to substance use and eventually problematic behaviors. So we don't have all the resources we need. Definitely not. No.
But you're making do with
We're
what
making
you
do
have.
with
have
what
to
we
do.
have.
So the takeaway as we get the wrap up is look out for your loved ones who you know may have issues.
Right, and Wayne Marshall's song "Overcome."
Yeah.
There's a line in it that said, "Don't drown yourself in a smoke or rum." This is not the time to drown yourself in those things because it's not going to help you to handle the disease if you contract it. So follow the social distancing rules. It doesn't mean that we can't be in touch with each other, call each other. You know, not everybody might have FaceTime, but you can WhatsApp, you can text. You know, keep connected to people because that will help us get through this.
All right. Thank you, guys.
876-564-HELP. 876-564-4357.
All right. Michael Tucker, National Council on Drug Abuses, Executive Director and Research Analyst, UK Atkinson. Up next, Jamaican students displaced in COVID-19 will soon come. And remember, wash those hands.